Have you heard about blood transfusion? Okay, so I'll be teaching about this, how this blood transfusion, what is blood grouping system, all these things. Okay, so I'll share the slides. Can you see slides?
Yes, ma'am.
Okay. So we'll be starting with the transfusion medicine. So this blood transfusion is very interesting. I don't know, maybe it's interesting for me, and then it will be interesting for you too. So today we'll be talking about the transfusion medicine. So we have 4-5 classes. So this is the first class, okay? So now today in this transfusion medicine, we'll be talking about history, how it developed and what was all those histories, and then definition, like what do you mean by transfusion medicine, and what are the common blood group types, and then the importance of the ABO blood group system. So today we'll be talking about history, definition of transfusion medicine, and what do you mean by blood transfusion, common types, and then the importance of the ABO blood group system. So now first we'll come to the history of transfusion. So it's not, this history is not important for you, but still just to make the class a little bit interesting, I have added all these things. So now you see here for the history, this blood transfusion, the idea of the blood transfusion appeared in 15th and 16th century ago. So now this is which century? So this is the 21st, isn't it? So it appeared in the 15th and then the 16th centuries with the belief that transfusion of the blood from the young and healthy persons into an aged or the debilitated individual would restore youth and health. So in those years, so many hundred years back, so that time it was believed that whenever the blood will be transfused from the young and healthy person to an old or the very frail person, then it was thought that they will restore or they will be healthy, and then they will be young looking. Understood here? So it came with that idea. So the same thing, the idea of blood transfusion appeared in 15th and 16th century with the belief that transfusion of blood from young and healthy person into an aged. All of you mute your mic, please. So it will disturb here. Whenever I ask you a question, that time you can unmute your mic and then speak. So that time it was thought that young and healthy person, whenever they give blood to the old or this sick person, they will be healthy and then the young. Understood here? So it came with that idea. So at that time, so Pope Innocent VIII. So in those years, Pope Innocent VIII was given blood from the 3 unfortunate persons. So that time in 1542, that Pope Innocent VIII was given the blood from the 3 unfortunate persons. And then that time the blood grouping system was not there. There was not ABO blood group system, and then the RS blood group system was not there. So they tried that time. So Pope Innocent VIII, and then the blood and the donors, 3 donors, all 4 died. Understood here? So here, that time this Pope Innocent was also unfortunate along with the 3 donors. So all of them died because that time they did not know that how much blood should be given. Nowadays we take 350 ml or the 450 ml, isn't it? So that time they did not know how much blood should be taken. That's why all 4 died. Unmute your mic. Mute your mic, please. So this slide I already finished, so I'll show you a picture. So you see here a picture, a person is lying down, Pope is lying down, and then a young boy, and all those boys, the three donors, they were just 10 years old. So they were young and then they were healthy. So their blood was transfused to Pope. And then that time they did not know this which blood group system and how much blood one can transfuse. So he was transfused more blood, and moreover the ABO blood group system, it was not there, and then grouping was not done. So he got more blood with the Pope got more blood with the from a different persons, and then from these boys also, from their bodies the more blood was removed, and then that's why all four of them died. So it's interesting, isn't it? So now after it was in the 15th century, isn't it? So now here in the 1704, Jean Denis tried to transfuse animal blood to a human being. So they wanted to do this test again. So that time they transfused the animal blood to a human being, and then the person died. Now, whenever the animal blood, nowadays also we don't transfuse the animal blood, isn't it? So human to human blood and then the animal to animal blood, it can be transfused. But that time in 1704, this person, Jean Denis, he tried to transfuse the animal blood to a human being, and then the person died. So to whom he transfused the animal blood, that person died, and he was accused of murder. So that time, so after that also the transfusion, this was not successful. So anyway, he tried. So now in this picture, you can see here a person is there, and then here the Jean Denis is there. So he's transfusing the blood from the sheep, isn't it? So from a sheep, and the sheep is tied in a pole, and from the sheep blood is taken, and then it is transfused to a person. So the person died, and then he was accused of the murder. So that time, this way it was the history. So now you see in the middle of 17th century, experimental animal blood transfusion was performed. So in case of the experimental animal blood transfusion was performed, so they did not try with the animal to the human being, but they tried from the animal to animal blood transfusion. So in the middle of the 17th century, experimental animal blood transfusion was performed, and then it became successful. So now in this picture, you can see one dog is below, and then another dog is sitting in the table, isn't it? So see, the dog, one is above, and then another dog is below. The dog which is receiving the blood is below because it has to go to the from the this donor dog. The blood has to go from the recipient or the recipient dog, isn't it? So now here you can see a dog is tied, and then this is a picture. So here now this dog to dog transfusion of the blood became successful. Understood here? So now here the dog which is giving the blood is above, and then now the dog which is receiving the blood, it is below. So now here it is tied with this transfusion, this tube, and then and it's red in color, so the blood is transfused. So it became the successful transfusion. So after the animal, so this may not be the picture of that time, but it's a latest picture only. So after the animal to animal blood transfusion became successful, so they tried with the human blood, human to human blood. So now you see here in the 18th century, British obstetrician James Bundell, along with the Dr. Leacock, he concluded that only human should serve as a source for the human blood transfusion. So that time only they told that, okay, after the successful transfusion from the animal to animal blood, so this obstetrician James Bundell, along with the Dr. Leacock, another with the doctor, so they concluded that a human blood should be transfused to a human person. So one blood from the human can only be transfused with another human. So that time they performed the first successful transfusion of the human blood to a patient for the treatment of the postpartum hemorrhage. Do you know the meaning of postpartum hemorrhage? Anybody? Anyone?
After delivery, several severe hemorrhage is there.
Okay, after delivery. Oh, good. After delivery, there will be the severe hemorrhage will be there, isn't it? So uh, this person was obstetrician, isn't it? So James Bundell, he was obstetrician. So after the delivery, there was massive hemorrhage, and then to save that person, a blood transfusion was done from one another person. So that time maybe the blood group and then even this cross matching somehow matched. Luckily it matched. So this female survived the postpartum hemorrhage. So she did not die because of this postpartum hemorrhage, but she was survived. So that time they concluded that the human blood should serve as a source for the human blood transfusion. Understood here? So now you can see here a female is lying down there, and she was suffering from the postpartum hemorrhage. So the blood was given from a person, one person here. The person is sitting here on a chair, and then his blood was transfused. So the female also survived, and then this person who gave the blood also survived. So that time only it came as a concept that okay, blood should be transfused from one human to human, but not from animal to human or the human to animal. So all those experiments, few experiments did not become successful. So finally this became the successful. So now here after even 100 years later, this is a picture of the Karl Landsteiner. So he was the one to give the concept of he was the one to have that this concept in the modern blood transfusion. So he introduced the system like the ABO blood group system. So this person is the Karl Landsteiner. So we should remember these persons, isn't it? So now here you see Karl Landsteiner discovered the ABO blood group system in 1901. So after 200-300 years later only, he discovered the ABO blood group system and laid the foundation of the modern blood transfusion. So after that ABO blood group system, so the A blood group is given to the A and then the B is given to B. So after that only this modern blood transfusion system was came into the light. So after this Karl Landsteiner, he identified the ABO blood group system, but still he found the ABO blood group system, but nobody knew that whenever the blood was removed from a person and then kept in some bottle or in a plastic bag, that time the blood life or the RBC life, it has to be increased, isn't it? So that's why the Roos Turner, he used the glucose. So he gave the concept that the glucose is useful in extending the life of RBCs under the storage condition. So the blood will be removed, and then whenever it is stored, previously the blood used to be stored in the bottle. So in my childhood, I have seen the this blood in bottle. Nowadays, this plastic bags and all this disposable bags are there. So that time he gave the concept that the glucose is useful for extending the life of the RBCs. So RBCs, whenever this glucose will be depleted, then that time the RBC destruction will be there. So that's why the Roos Turner, he gave the concept that the glucose is useful in extending the life of the RBC under the storage condition. So after that, another person, he gave another idea that that person is the J. Lewitt and then the P. Mollison. They, for the storing of the blood, they produced a solution that is the ACD solution. So now we also use the ACD and then the others also, but here you see it was the first one. They said that acid, citrate, and then the dextrose. So dextrose is a glucose, isn't it? So here the dextrose is used for the survival of the RBCs. So they gave the idea that the acid, citrate, or the ACD solution for the storage. So what all these things it will do, I will tell you later on only. So here one will prevent the coagulation. Whenever the blood is, you must have seen, isn't it? So whenever the blood comes out, that time it clots, but the clotted blood cannot be given to a person. So we use the anticoagulant in the blood bag. So that is the acid citrate dextrose. So now here the dextrose is the glucose, and then the acid citrate, it will act as the anticoagulant. So it was stored for the, it can be stored for that time up to the 35 days. Okay. Now, after that, again in the 1960 and then the 1965, and then the citrate phosphate dextrose adenine. So now this became little bit more, now from the ACD, it became the CPDA. Now the CPDA means now the citrate, C for the citrate, P is for the phosphate, and then the D is for the dextrose, and A is for the adenine. So this CPDA, it acts as a better preservation and then the preparation of the blood components in the closed system. So now here in a closed system blood components preparation means you must have heard about the blood components. Have you heard anything? Have you heard blood components? So previously we used to use the whole blood system. So in that blood, the plasma will also be there, RBC will be there, WBC will be there, and then the platelets will also be there. So now the preparation of blood components means whatever is required. So suppose if the RBC is only required, we give the compact RBC, and if the WBC is only required, we can take out the WBC only. If the platelet is required in case of the dengue or in case of malaria, that time we can take. Here I'm talking about the our scenario, isn't it? So our country's things. So that time we can take out the platelets, and then so we can give whatever is necessary to a person, we can give that, isn't it? So if platelet is only necessary for a person, then why to give RBC? It's not necessary, isn't it? So now here you see more than the ACD, that's this citrate phosphate dextrose or the adenine, it acts as a better preservation and preparation of the blood components in a closed system. So it means that it can be separated. Nowadays apheresis system is also there. Now here it's better. Now it will have the better preservation and preparation of the blood components. Blood components means it may be the packed cell, it may be the WBC, we don't use that much, but the platelets and then the fresh frozen plasma. So these are all the blood components. So we can do it in a closed system, means the within the tube to tube or within the bag to bag we can transfer. Are you understanding?
Yes, ma'am.
Okay. Is it interesting or it's boring? It means boring, isn't it? So nobody answered.
Interesting.
Anyway, but still you have to study, isn't it? So some of the subjects you may not like, but still you have to know. Okay. Now here, I'll try to make as much, make you understand how much I can. But now you see here now, that anticoagulant and then the preservation I told you, isn't it? So now first, now history and little bit about the anticoagulant is finished. Now we'll come to the definition. What do you mean by transfusion medicine and what do you mean by the transfusion? So transfusion medicine, it is a branch of medicine. So transfusion means it is the transferring of the blood from one person to another, isn't it? So transfusion medicine definition means it is a branch of medicine that is concerned with the transfusion of blood and then the blood products. So the transfusion of the blood means so whole of the blood, like whenever we take out some blood, that time RBC, WBC, platelets, and then the plasma, all these clotting factors, everything will come together in a blood bag, isn't it? So that is known as the transfusion of the blood. And then the blood products means, so it may be the whole blood, it may be the WBC, it may be the platelet, it may be the fresh frozen plasma, it may be the platelet concentrate. So different types of the blood products are there. So I'll teach you in other classes, later classes. So now here transfusion medicine means it is a branch of medicine that is concerned with the transfusion of blood and then the blood product. So it's easy, isn't it? So whenever there is the transfusion of the blood and blood products, so it is known as the transfusion of medicine. So now what do you mean by transfusion? So the same thing, it is the transfer of the blood and then the blood products from one person to another person. So now from one person, the person who gives blood is known as donor. So you all know all these things, but still I'm teaching you. So the transfer of the blood and then the blood products from one person, that is the donor, to the another person, that is the recipient, is known as the transfusion. Understood here? So transfusion means the transfer of the blood and then the blood products from one person to another person's bloodstream. Means the donor will give the blood and then the recipient will receive the blood. That is known as a transfusion. So now we'll come to the common types of the blood group system. So now here there are the different blood group systems. So then we only require the ABO and then the RS system. Okay. So but still we ask you whenever there will be practical for you, then we'll be asking you questions like whenever the blood grouping is done that time, or we can ask you questions. So what are the different type of the blood group systems? Then ABO blood group, RS. So don't tell first Duffy, KL, MNS, P, all these. Okay. So first you have to say that if you don't remember all other things, at least you have to tell that ABO and blood group system and then the RS system. So first students, they tend to say Duffy P system. So first you have to say the ABO system and then the RS system. So the common types of the blood group systems are the ABO system is there, RS system, Lewis system is there, P system is there, Kell system is there, MNS, Duffy, or the Phi Duffy, and then the Phi system is the same name here. So there are the various different many these blood group systems are there, but still ABO blood group system and RS system. So we'll be asking you this questions whenever this practical in your practical exam, like whenever you will be doing this blood grouping, that time we'll ask you questions related to this blood transfusion. We can ask you in other main theory viva also, but still we love to ask in this one. So you have to remember the ABO blood group system and then the RS system. So the common types are the ABO, RS, Lewis, P system, Kell system, MNS system, and then the Duffy or the Phi system. So remember, if you don't remember the others, if you remember whole thing, that's good. But if you don't remember, but you have to remember and you must answer ABO and RS system. To so many times I have asked to the students, they tell Kell Duffy, but first you have to say the ABO system, normal system you should ask, but not the abnormal one. So now we'll come to the importance of the ABO system. So now here in the ABO blood group system, there is the A and then the B antigens are inherited as per the Mendelian law. Have you heard about this Mendelian law? Have you heard the name about this Mendelian law?
Yes, ma'am.
Okay. So in that there will be the cross matching, and then from the it started with the P, isn't it? So that P plant, I think so. I'm not sure, but still you can confirm. So according to the Mendelian laws, this antigens will go half to the kids, isn't it? Offsprings and all. So here also the same system is there here. So A and then the B antigens are inherited as per the Mendelian law. Understood here? So in case of the ABO blood group system, it is determined with the presence of whether the person is having the A antigen, that is the AA antigen, or the BB. Understood here? So whenever it is AA or BB, it is known as the homozygous. Understood? Homozygous and heterozygous also you must have heard, isn't it so? So ABO blood group is determined by the presence of one AA or BB, that is known as the homozygous, or because of the presence of the two alleles, that is the AO or the AB. So it may be the BO also. So just for the example, I have written AO or AB. So this is known as the heterozygous of the three alleles. So ABO. So now here what happens, AA is a homozygous and BB, if it is same, it is known as the homozygous, and if it is different alleles, then that time it is known as the heterozygous, isn't it? So now here AA or BB is known as homozygous alleles, and then here AO or BO or AB, these are the heterozygous. Understood here? So it depends upon according to that Mendelian law. So now here at birth, there will be the H antigen will be there, A antigen, and then the B antigen will be there, and which is not fully developed at birth. So these antigens will be present in a person's red blood cells or in the blood, but these A antigen, B antigen, and H antigen, they are not fully developed at birth. So about the H antigen and about this mumbaI blood group, I'll tell you a little bit more tomorrow. But today's class will mainly focus in the A and then the B ABO blood group system. So now you see this slide, A antigen, B antigen, and then the H antigens are not fully developed at birth. Understood here? That's why whenever we do the blood grouping of the children, then that time little bit confusion will be always be there. Understood here? So for the development of the proper development of this antigen, it will take the about 1 year. Understood here? Complete development is attained by 1 year of age. This slide, did you understand?
Yes, ma'am.
Actually, here what happens, this H antigen will produce the A antigen, and this H antigen will produce the B antigen, and this H antigen itself will remain in the blood. Understood here? That's why this is the H antigen which gives rise to the A antigen also, and H antigen is act as a precursor, and then this will also give rise to the B antigen. So now whenever this is giving rise to the A and then the B antigen, that's why A antigen, B antigen, and then the H antigen all will be there in our blood. Understood here? So that's why here the first line means that one. A antigen is there, B antigen is there, and then the H antigen is there, but these are not fully developed at birth. So for the development, for this full development of these antigens, it will take about the 1 year of age. So now we'll come to the antigens of the ABO system. Now here we have not written the H antigen. So I told you already that, okay, H antigen is the one which gives rise to the A antigen and then the B antigen. But the ABO system, in the ABO system, we don't talk much about the H, but still the H antigen will be present in our blood group, understood it, or in our blood. So here the A and then the B antigens are located on the red cell membrane. So RBC, it has got the membrane is there, isn't it? So you have finished anemia, isn't it? So anemia or this, so there you on the surface of the RBCs, what is there? All these you must have this antigen you did not study, but for the RBCs membrane is there, you must have understood by this time. So in that flexible RBC or in that round RBC, so there will be the A antigen and then the B antigens. These are located on the red cell membrane. Understood here? So the red cell membrane is there. It will, and on the surface of this red cell membrane or the RBC, there will be the A antigen and then the B antigen will be there. So now we'll come to the subtypes of the A antigen. So there is no subtypes of A antigen, but there are the different subtypes of the A antigen also. So now you see here, there is the A1 subtype is also there, and then the A2 subtype is also there. But whenever we will do the grouping of the person, that time we don't tell this person is A1 blood group, we don't say, but we tell the A blood group, but we will tell the B blood group, isn't it? So but the B serotypes, it doesn't have the subtype, but the A antigen, it has got the subtypes also. Did you understand here? So the subtypes of A, one is the A1 and then another one is the A2. So the A1 comprises more of the percentage, that is the 80% of the blood group A individuals are A1. Understood here? And then the 20% are the A2. So while doing the blood grouping, we can distinguish A1 and A2, but usually this will not be done, but it can be differentiated also. So this slide, did you understand?
Yes, ma'am. Yes, ma'am.
So I don't know, in practical, whenever we will ask what will be, suppose if you are a blood, suppose I ask to a student that if your blood group is A positive, what will be the antigen? Suppose the person may say answer is the A antigen, isn't it? So, but if I ask where the antigen is present, then somebody will say in the plasma and somebody will say somewhere. So here you have to remember that this A antigen and B antigen, these are located on the surface of the RBC membrane. So this I just want to make it clear. So I hope you won't let me down while asking Viva. So here it will be present on the surface of the RBC. So here the subtypes of A1, that is the A1 is there. Subtypes of A is the A1, 80%, and then the A2, that is the 20% is there. 80 and then the 20, more comprising the A1 type. Now, ABO, in the ABO blood group system, now you see here this slide, blood group A person possesses the anti-B antibodies in the system, serum, or in the plasma. Serum and then the plasma. Do you know the meaning of serum and plasma? Yes?
Plasma minus clotting factors.
Okay, serum means? Okay, you may not be knowing, so I'll tell you.
Plasma minus clotting factors.
Okay, without or with clotting factors, serum means?
Without.
Good. Okay.
Without.
Oh, good. All of you know, but still some may not know, and some may not hear your voice clearly. So still I'll tell you. So plasma, whenever the blood is not clotted and then the blood is removed and then the RBCs settle down, something like a little bit off-white or the cream color or the whitish fluid will be there. So that is known as the plasma, and the plasma will have all those clotting factors and all, isn't it? So now whenever the blood is clotted and then something like brownish fluid is separated from the blood, clotted blood, that is known as the serum. So now you see the slide here, this one, this blood group A person possesses the anti-B antibodies in the serum. So the person will have the antigen with the A antigen, but in the serum there will be the antibody will be there, isn't it? So what antibody will be there? That will be the anti-B will be there. If there would be anti-A, then what would happen? It will clot, isn't it? So antigen and then the antibody will clump, isn't it? So there will be the agglutination will be there, isn't it? So that's why the blood group A person possesses the anti-B antibodies in the serum, and then the blood group B person possesses the anti-A antibodies in the serum, and then the blood group O possesses the anti-A and then the anti-B antibodies in the serum. So now this is also important for you because we'll be asking you the same thing. What will be the antigen on the surface? Suppose a person is A blood group, and what will be the antigen on the surface, and what is the corresponding antibody in the serum or in the plasma? That time students, good students, they answer, but still some students, they are unable to answer. So you have to remember this slide, or you have to remember this thing. Suppose if a person is A positive, so A blood group, so in that person's serum or in the plasma, there will be the anti-B antibodies will be there. So the antibody will be the anti-B. If a person is blood group is B, then in the plasma or in the serum, there will be the anti-A antibody will be there. But if it is O, then there will be the anti-A and then the anti-B antibodies will be there. If it is AB, then what will be there? If a person AB,
No antibody.
oh, good. Okay.
No antibody will be there.
Okay. I hope you'll answer in Viva also same, okay? Now here we will come to the distribution of the ABO antigens and then the antibodies. So now in the first row, you can see here A is there, B blood group is there, AB blood group is there, and then the O blood group is there, isn't it? So for the person having the A blood group, on the surface of the RBC, we will have the A antigen is there, isn't it? So, but together with the A antigen, there is also, I told you, isn't it? So H antigen is the one which gives rise to the A antigen and then the B antigen. That's why this H antigen will be there in every human being. So except in that mumbaI blood group, which is very rare. So here, that's why the antigens on the red cells will be the A and then the H will be there. Understood here? in case of the B blood group, there will be the B and then the H antigen will be there. And in case of the AB blood group, there will be the A antigen, B antigen, and then the H antigen is there. If it is the O, now there is no antigen, isn't it so? But in that person's, the antigen on the surface of the RBC will be H. So if you say H antigen will be present, that is also okay. But if you say antigen A and then the antigen, in case of the blood group O, if you tell that antigen A and then the antigen B is not present, that will be also good. Understood here? So now here we'll come to the naturally occurring antibody in the blood. So in case of the blood group A, there will be the anti-B, which I already told you. But on the surface of the RBC, there will be the A antigen and then the H antigen. And now in case of the blood group B, on the surface of the RBC, B antigen is there and then the H antigen is there. But in the plasma or in the serum, anti-A will be there. And in case of the AB and then the H is there. So in the plasma or in the serum, no antibody will be there. But if it is the blood group O, now in the blood group O, A antigen and then the B antigen is not there, isn't it so? But now we will find the H antigen on the surface of the RBC. So now here in their plasma, we will find, or in the serum, we will find the anti-A and then the anti-B. This slide is clear?
Yes, ma'am.
Okay.
Yes, ma'am.
Do I have to repeat this slide? No. So this you have to remember. If you don't remember H, it's fine. But suppose if in the on B blood group, what is the antigen and what is the antibody? This you have to remember, because while doing that practical is important. And then usually simple questions like these are asked in your practical exam also. So this you have to remember. Now we'll come to the ABO antibodies. These ABO antibodies, they are the naturally occurring anti-A and then the anti-B antibodies. And these antibodies are the immunoglobulin M type, IgM type. And then they react with the red cells of the corresponding antigen, resulting in the severe hemolytic transfusion reaction. So this sentence, did you understand? So now here these anti-A and then the anti-B antibodies, they are the immunoglobulin M type, and they react with the cells of the corresponding antigen, resulting in the severe hemolytic transfusion reaction. So to a person, suppose if a person is having the B blood group, okay, on that person will having the B antigen on the surface of the RBC, isn't it so? But now if that person will be given the A blood group, now what happens? In the A blood group, the antibody will be the anti-B, isn't it so? A blood group. So if that blood is given to the person with the B blood group, then the anti-B and then the B antigen will lead to the hemolytic transfusion reaction. Understood here? So this is the same thing that, okay, whenever antigen is there, A antigen is there, and then now the blood having this anti-A is given, or the B blood group is given, then it will lead to the clumping and then it will lead to the severe hemolytic transfusion reaction. So now we'll come to the ABO antibody. This slide once again. These are the naturally occurring anti-A and then the anti-B antibodies, and these are the immunoglobulin M type. So you have to remember the immunoglobulin M type. So in your MCQ, so I may give immunoglobulin D, immunoglobulin A, all these. So that time you have to remember the immunoglobulin. So all these small things like immunoglobulin M type, that will come in your MCQ. So these are the naturally occurring anti-A and then the anti-B antibodies. So these are the immunoglobulin M type, and they react with the red cells of the corresponding antigen. Means if it is A antigen is there, then it will react with the anti-A and then it will result in the severe hemolytic transfusion reaction. So that's why we do the cross matching, whether the blood is matching or not. That's why after the blood cross matching is done, and then there will be no clumping of the blood or no agglutination of the blood, then only we transfuse the blood. We suppose if a person is A and then then another person's is also A blood group. So usually we don't give blood like that, but still we will do the major cross matching and then the minor cross matching of a person. Then only we will do the transfusion. Otherwise, there sometimes because of the other antibodies also there can be the hemolytic reaction. So we want to not to occur that hemolytic reaction. So we do the cross matching and then we give the blood. So now little bit we will come about the ABO system and then the disease. So here you see in the blood group O persons, anyone blood group O. So they are 1.5 times the risk of developing the peptic ulcer. Understood here? So O, they are having the chance of having the peptic ulcer. And then if a person is blood group A or if a person is A blood group, then the person is having the 1.2 times the risk of developing the gastric carcinoma than the blood group O and then the blood group B. Understood it? So, but still this is done in a very large data, isn't it? So if you, this is the ABO system and then the disease. So no need to worry also. So now the blood group O, they are having the 1.5 times more the risk of developing the peptic ulcer than the blood group A, B, and then the AB. Now the group A, they are having the 1.2 times the risk of developing the gastric carcinoma than the blood group O and then the B. So this is the ABO system and then the disease. This is not much important. Now we will do the I don't know how much I'll be able to teach you. Now the time is also going. So now we'll do the ABO blood grouping. So for performing the ABO blood group system or the ABO grouping, now we want to identify whether what is the blood group of that person, isn't it? So for that, ABO grouping is carried out by making the 2% saline suspension of the red cells, adding anti-A, anti-B, and then the anti-AB sera. So now here in the we'll make this one saline suspension of the red cells, and then we will add anti-A, anti-B, and then the anti-AB sera. So now, so whenever this anti-A is added and then anti-B is added or the anti-AB sera is added, you haven't done no practical yet? You must be in that corona pandemic, isn't it so?
Yes, ma'am.
Okay. Have you ever seen somebody doing blood grouping?
Yes, ma'am.
Okay. Your parents must be doctor, isn't it so? So here we'll make the saline suspension of the red cells with the 2% saline. And then we will add the anti-A, anti-B, and then the anti-AB sera. Why we add the anti-A, anti-B, and then the anti-AB? Usually in your practical, only the anti-A and then the anti-B will be given. But in the blood bank, usually anti-AB sera will also be used. Understood? So there are the different techniques or the different methods of blood grouping is there. One is the slide technique is there, and another one is the tube technique is there. So under the slide technique, we'll prepare in a slide, we'll put one drop of the blood, and then we'll put this sera, anti-A or the anti-B, and then we will see whether there will be the clumping of the blood or the agglutination of the blood will be there or not. But in case of the tube technique, we will put the blood, we'll make the 2% saline, and then we'll put this anti-sera, and then we will see whether the agglutination is there or not. So if the agglutination is there more, we can see with our own this naked eye also. But whenever we have to, while doing the cross matching, we will see under the microscope. So today I'll stop here. So today I'll not be putting this, upload the slide. So tomorrow maybe I'll finish this whole thing. And then today's class, did you understand? All of you, did you understand up to any question you have? Tomorrow also same class, same time, 10 o'clock is there. So I have, there is a chart is there. So at that time I have to make you understand this, where will be